Good afternoon, everyone. My name is Kate Galantich, and on behalf of Carasoft Technology, I would like to welcome you to our webinar, Leap into the AMC Experience. The audio portion of this webinar can be heard through your computer speakers, and all lines have been muted to reduce any background noise. If you would like to ask a question throughout the presentation, please use the Q&A feature at the bottom of your screen, and we'll do our best to answer them at the end of the presentation. This webinar is being recorded, and you will receive a link via email following the webinar. So before we start, just some quick background about Carasoft. Carasoft Technology Corporation is a trusted government IT solutions provider. The company combines technological expertise with a thorough understanding of the government procurement process to help federal, state, and local government agencies select and implement the best solution at the best possible value. Then now to introduce our speakers. First, we have Steve Boberski. Steve is a Genesys public sector CTO. He brings over 2 decades of experience designing and delivering and selling large enterprise VoIP, unified communications, and contact center solutions to help government agencies create superior engagement with constituents and employees. Steve has provided leadership, strategy, and systems engineering expertise to help multiple organizations obtain, maintain, and enhance compliance with mandated IT policies, including FedRAMP. Next, we have Trevor Kelly. Trevor, based in Charleston, South Carolina, is a principal solution consultant with the Genesys Public Sector and Education team. He brings deep expertise in customer experience and cloud technology, having spent much of his career working with higher education institutions in various roles, including application developer, consultant, and solutions architect. His passion is to help enterprise organizations solve their business challenges in new and innovative ways. Lastly, we have Dr. Atif Mohammed. Dr. Atif Mohammed is an AI expert with a PhD in scientific computing from University of North Dakota and a PhD in cloud cybersecurity from Canada. He possesses extensive AI leadership background in modernizing corporate operations and accomplishing strategic goals. He is an enterprising digital business executive who excels in recognizing, evaluating, gaining consensus for, implementing, and empowering technologies and enterprise systems that streamline business processes and drive significant transformations. And with that, I will hand it over to Steve.
Hello, I'd like to welcome everybody and thank you for attending. I'd like to thank Carasoft for hosting this event, and certainly Dr. Atif, our esteemed guest from GTS, one of our valued partners. Genesys, for those who do not know, is our Gartner Magic Quadrant leader, customer contact center as a service, and or CX, customer experience, you might say. Also, recently awarded Best in Show for Enterprise Connect for innovation in AI and CX innovation. So we're very proud of that. And today we're going to have a really good discussion on artificial intelligence, particularly on GTS's new medbot in the market today, and how we integrate that with Genesys to really accelerate and enhance the experience for customers. Dr. T, without any further ado, I will turn that over to you.
Thank you so much. I'm going to share my screen. Sincerely grateful, Steve, for your intro, and Kate, you're bringing in the details. Let me quickly bring in the screen here. So kindly double confirm if you can see my screen.
Yes, we can.
Perfect. So we will be discussing the medbot. I'm Dr. Atif Mohammed, the Chief Data Officer and Chief Information Security Officer of Global Technology Solutions. And the Global Technology Solutions is a customer experience and artificial intelligence company. We will be discussing in this webinar the consumption of medbot, which brings in the improved communication, enhanced patient care, operational efficiency, help in diagnosis, early detection, helping in accurate diagnosis and tailored treatment plans for the providers. That can be physician, that can be practicing nurse, serving in the capacity of in an academic medical health center to the students and all the stakeholders. Enhanced patient care definitely comes in HIPAA compliance, the PHI compliance and the PII compliance comes in automatically. Other than that, the personalized care provided by the PCP reduced medical errors and proactive interventions by working on the documents on the bedrock use on the back end, AWS Bedrock. That also introduces the operational efficiency by streamlining the workflows, optimized operations, and resource allocation. Helped in the diagnosis, accelerated findings, clinical trials, and health data analytics when we are asking questions to the document in specific that is to be dealt with the patient, with an insurance claim, or with billings, or anything else associated to the AMC in specific. The ethical consideration and implementation by global technology solutions are privacy protection, where we handle the data with, with very much care because it is a sensitive healthcare information and it needs to be dealt with absolute privacy to a patient. Equitable access, addressing disparities and ensuring fair access to advanced healthcare technologies, which are associated with Genesis solutions provision as well. The transparency in decision making. This allows the MedBot and technically influences the healthcare decisions, and it allows the PCPs, nurses, and administrative staff in an AMC to help them make decisions faster and reduce the average handling time of a potential call that is in progress. The impactful benefits of the GTS MedBot are to have the assisting capabilities and capacities in all areas of healthcare delivery and patient outcomes for their betterment of their health. Privacy imperatives are significant, where the privacy implications of the MedBot require careful consideration and responsible implementation. This is the main reason we work with AWS and Genesys in specific. And let's look at a student journey academic medical center use case, and this will allow you to understand a little bit more in depth. So, as a student myself, when I came from Canada, I had these questions because the healthcare system differs. And if I put myself in, this is pretty near and dear to an international student or any student who's moving from one state to the other state. A student's friend tells me to look more healthcare provisions, services, and insurance. And that friend is technically a third party who is a student's friend, and the student who's trying to find this thing is very thankful to the great advice. The student who's trying to find the information tries to find comparison of health insurance from Google to the university information, still thankful to for friend's suggestion, goes back to the university site and finds more links, now getting a little bit confused, start reading the documents, thinks this seems easy. However, asks what's next to the legacy search. What is a legacy search? The standard Google search, standard uh, payer or insurance providers web search. Clicks on the health insurance websites and then search benefits, feels still confused, and decide to try again in case missed the previously, does not understand search information and goes back to the university homepage for further asking. Search pharmacy services again on the another pharmacy website, because when you deal with the healthcare you have to deal with the pharmacy most of the time, and there are times you have not. And again search other pharmacies on Google again, feels still confused, does not find a grasp on standard search, goes to the university website, initiate a search with GTS CX solution powered by AI, and finds it very helpful, think this is great. This is a complete GTS AI enabled contact center for healthcare provision, a student journey. A patient journey is a student journey here that needs an appointment to schedule to meet with the specialist or the physician, and might need pre-visit labs and might need the lab tests scheduled and order those tests. The diagnostic info is needed by the physician or the primary care provider to look into details. The patient connect happens, treatment plan comes into the fruition, estimates happen if there is a specialist involved. specialist appointment is needed for further procedure. Procedure notes are needed to be taken care, and up to the medical economics where the social determinants of health kicks in, at home recovery, medication adherence, condition management. A student has to go through in an AMC in all these cycles towards the betterment. So there are a few case studies I have mentioned here in the slide: scheduling, billing, insurance question and answers. I want to book an appointment. For example, 11 a.m. is my time. What is my balance? Medical FSA. I'll be showing it to you hands-on. When is the payment due and all that jazz. You can look at these set of questions which are on your screen. What happens if I miss a payment or something like that? Let's now jump into the demo and takes you to a whole different screen at this moment. So let me change my screen. Please tell me when you see the screen.
Looks good.
Okay. So hi, I am a medbot. I am a chatbot here to help you. If I invoke it and I say hello, let me switch on the voice. It is voice enabled, so it can answer you if you are hard at seeing. How can I help you? I need an appointment. Okay. Would you like to meet a specialist or a physician? I say physician. Okay. At what time would you like the appointment? I say, let's say I say 1 p.m. Can I go ahead and book the appointment with the physician? Yes. Your appointment with the physician is booked for 1,300 hours. What is my bill? Okay, absolutely. We can resend your bill electronically to your email address, and then alternatively, you can access the bill through. So it is actually suggesting that the bill can be seen at this. I need to know my balance. Okay, for verification purposes, what is your date of birth? Let me take date of birth. Okay, what's the account? Billing. And you can see that, thank you. The current balance of your billing account is $98.49. Your last visit's payment is due by December 25th. It's a random answer that came out. I want to know about my FSA, for example. Your current balance is in your medical bills account $486. Your last visit payment is due in October. So this is just a demo, and I want to know more details about my, let's say, the document that is in the care provision office. So what I'm going to find. It's a random thing. I want to query your document. Please specify the title of the document. Let's say if I say I have given Jake test a document, which is there. What's your question? Who was the king? So since I have random documents, so I'm just asking a random question that is associated with the Jake test document that I have given in this demo. Now this is generating an answer using the generative AI. So it'll take a little while because this is a test case. There you go. The answer can be found in the last paragraph of the provided text. He is abdicated government. He has abdicated government here by declaring us out of his protection and waging war against us. The king being referred to as King George III of Great Britain. But or can you tell more? Can you tell more? And let's see what answer comes. It's a possibility there might not be an answer coming. There you go. I'm happy to help. However, I don't have access to the document you provided. I can answer only a few questions. So let's see if I want to ask another thing. I want to query your document. Okay, I say HUD. How can I rent an apartment? And this is okay to not to carry the standard denomination like it should be capital and all that. This gives you complete control. So you can search for privately owned apartments with reduced rents using the map, and then da 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 da. This goes on. And you can also ask it as many questions as you want. These are all generative AI generated answers, and these are guardrailed question and answers on the provided documents. So since we are dealing with the healthcare, so I had to make sure that these are guardrailed, 100% implied that they should not get out and hallucinate. So we have uh, extensively tested these documents and trained these machine learning models on the back end using the SLMs, which are the small language models. Now let's see if I have to speak with an agent. I like to talk to an agent. Okay, connecting with the agent, and that's where I'm handing it over to Trevor.
Fantastic. Thank you, Dr. Atif. Let me go ahead and start sharing my screen from let's say a patient access care team member or an agent's perspective. Once it does come into the back end of Genesys, I'm going to walk through a little bit of what your staff would see, because while the advancements in AI have been incredible to watch over the course of the last year or so, and especially some of what Dr. Atif was showing and what GTS has built with their chatbot and being able to use generative AI, there are going to be some cases where it does need to be escalated up to an agent and have that level of care provided so that we can more closely look at what the particular question might be, yet still have access to the tools where AI can be really, really helpful in helping to, we're almost calling it like a co-pilot program where AI is sitting alongside the agent to ensure that we're responding appropriately based off of what they're asking about. So with this, I actually started this a little bit earlier in my environment just so that I'd have something up and running, but I do have the ability to scroll back through and see the complete history of what the patient had been discussing with the bot. So if I need to clarify anything that was responded to in any of the questions, I can go back in and see exactly what was asked. We also have a number of different tools on here. In fact, let me, before I get too far into this, give a little bit of an orientation into what we're seeing with Genesys Cloud. So this is the agent's perspective of Genesys Cloud. You can see that Genesys Cloud is a web-based application that's accessible to your teams from anywhere on any device, as long as you've got an internet connection. So I'm actually logged in through Google Chrome and accessing this. I have the ability to go in and see my particular agent activity. I'm logged in as a referral nurse right now. I have the ability to go in and see when I'm supposed to be scheduled to take inbound phone calls, inbound chats, as we're doing right now. Genesys also supports text messages and emails that might be coming in to your teams. I'm actually out of adherence right now because I'm not supposed to be on queue logged in at all today. I'm not supposed to log in until tomorrow, so it does let you know. And of course, all of these metrics get rolled up into supervisory and management type reports as well. So if I'm out of adherence, if I am spending too long, or if I'm not actually picking up on certain interactions, supervisors and managers would get notified on that as well. I also have access to a few different metrics like gamification. Am I reducing the amount of times that I'm transferring calls or transferring chats that are coming in? I've got some assigned modules that have been assigned to me regarding maybe patient or practice protocols that I should be following, or new updates to different systems that I should be aware of in case I get asked about that. And also any evaluations on interactions that I've worked on over the course of the past week or so or month would show up here, so I can see how I'm doing at any given time as somebody who is directly interacting with patients. So let me go back. I do want to focus a little bit more on this particular interaction that came through to me. You didn't see when it actually came through because I went ahead and I opened it up as Dr. Atif was speaking, but any new calls, emails, text messages, or chats would show up in this panel. You do have the ability at your organization to control how many simultaneous chats, emails, or text messages you can be working on at any given time. Normally, if it's a phone call or a voice interaction, we don't necessarily serve those up to the same care associate because normally if you're focused on a voice call, that really requires 100% of your attention. However, we have had some institutions where if they have a code blue and they do want a voice call to interrupt anything that they're doing, we have the ability to have that come in as well. One thing also that I'll quickly mention before we get into some of the other tools here is that these interactions get routed in a really, really sophisticated manner with Genesys. In fact, some would say that we've got the most advanced routing algorithms out there in terms of how interactions get routed to the right individuals based on skills, based on the last time that they've interacted with anyone. We also have predictive routing algorithms that will go in and take specific metrics that you put into the configurations and determine, okay, we need to reduce the handle time, or we've got other KPIs that we're trying to drive. And it automatically knows, based off of machine learning, who the best agent would be in order to drive those metrics and meet your KPIs that you're looking to achieve there. All right, so in addition to actually seeing the entire chat history of everything that this particular patient looked at with the bot, we also have a few tools that I want to quickly spend some time on. One is we've got a co-browse feature built within Genesys. So this is out of the box. A lot of times we see that patients have some challenges when it comes to filling out forms or going to the right places within their MyChart or within their patient portal, and they need some hand-holding along the way. So we have this co-browse area where when I click on it, what it's going to do is it's going to initiate a co-browse session. If I go back to my chat window, I am being offered the ability to share my screen, and I can either accept or decline at this point. I'm going to go ahead and accept so you can see what that looks like. Once I've done that, the agent now has access to see what the patient is seeing. So whether it's, again, trying to go in and fill out a particular form or access particular areas within their patient portal, the patient care team representative would have access to that. And notice that you can also draw. You can even offer to give the agent control of your screen or being able to click around if need be. Let me go back so we can see what the agent is seeing. So here's where I, as an agent, would be able to request control from the patient, be able to request navigation. I can even expand this even bigger so that I can get a better viewpoint into the web browser and what they're doing there. All right, so I'm going to close that out, and then it brings me right back to this message thread. The other quick thing that I want to bring attention to, speaking of AI and the tools available to help co-pilot with the agent as they're going through some of the questions that might be coming in, is this Agent Assist tool. So I'm going to open this up, and what it's going to do is it's actively looking at the conversation that your patient care team is having with the patient that's chatting in. So for example, if I go over to the chat, and the patient might ask a question such as, how do I use Trulicity? And submit that into the chat. We now have some automated served up knowledge articles that as an agent I can use to determine what is the best response for this particular question. And if I click into this first one, it's going to give me a link that I can put in there. And rather than me copying and pasting it into the chat, I'm just going to do a one-click copy to chat. I can edit as I see fit. I might have hit enter twice. And then it's there for them to see right there within the chat. So really easy to go in and quickly and efficiently put in answers to questions that patients might have and have access to a consistent knowledge base of responses that are in here. Notice that there's also the thumbs up, thumbs down, so that you can rank, was this an appropriate response for this particular question that the patient asked? And this, again, feeds into the AI model for machine learning so that next time somebody asks this question in the same way, we've got a more accurate way to respond to it. Now, here at Genesys, as you can probably tell from the session that we've had so far, we are very, very focused on our partnerships. We believe at Genesys that we can achieve great things when we're all working together as one with our different partnerships that we have. And you see that because, you know, our great longtime partner, Carosoft, helped host this webinar today. GTS has been a long-term partner with Genesys as well. And you can see the really exciting medbot that they put together, that they've built on top of Genesys technology. We also have a few other really, really great partnerships that I'm just going to quickly walk through. One is the ability to escalate this conversation into a video engagement. So Genesys has an App Foundry, and one of our App Foundry partners is Video Engager. Just so that you can see our App Foundry, I just searched in the word video, and this searches our entire app marketplace. These are all of the third-party vendors that have built extensions above and beyond what Genesys does out of the box. So Video Engager is one. If you actually drill into, and this is a public website, it's just appfoundry.genesys.com. You can look at any one of these vendor solutions, click into the details. You can see whether it's HIPAA compliant, which Video Engager is. You can see a description. You can even see some screenshots and videos that they've submitted. So to walk through what this looks like, if I need to escalate this particular web chat into a video chat, I can invite them because I've already got Video Engager installed in my Genesys environment. I'm going to invite them. It's going to direct the patient to a website, vidme.in, and prompt them for a 4-digit PIN. In this case, it's going to be 1901, so I'm going to go ahead and put that in there before anyone on the webinar does. And that's going to initiate this video session. And while I double mute myself so that we don't get any sort of feedback, you now see that I've escalated this to a video session. You can see hopefully my face here. I'm looking back and forth to my phone that I have pulled up here with the video session live. So you can have a real-time video telehealth session, if you will, with the patient if they're asking about a specific thing that really needs to go above and beyond just a texting chat that's on here. All right, so let me go ahead and close out of that. In addition to Video Engager, we have a few other kind of cool things that I want to walk through. I do have what we call in Genesys Cloud, a script that I've pulled up. And this is where we can integrate directly with your EHR system of choice. And we've got fully baked, pre-built integrations with Epic, Cerner, Athena. We've got a number of different integrations that are out there. This is also where we can, again, have a nice partnership with your EHR system so that we're not having your patient care team have to have multiple windows or tabs open in order to get all of the information that they might need in order to best serve that patient. So first thing is that we were able to identify them through the bot, and we authenticated them. If you remember Dr. Atif, when he was going through his demonstration, we were able to verify the patient's date of birth. We might be asking for the last four of their social security number. They're probably not going to know their MRN number, but if they do, that could be an attribute that we use to identify them and perhaps authenticate them. This is going to shave a lot of time off of when the patient is interacting with the agent. This way, the agent can quickly address what the patient needs without having to go through the 45 to 90 seconds that it takes to identify and authenticate them. And that way, they can quickly wrap up, go to the next patient, and not have to spend a lot of time doing things that could be done in the self-serve IVA or the bot that Dr. Atif was showing. So we were able to pull out, demographic information about the patient, like their address. I can actually pull out what their intent was within the bot. I could see that they wanted to make an appointment, when the appointment was, what the appointment's for. I can go into some additional detail about this patient, see what their MRN number is, see when their date of birth is, how many appointments did they no-show, how many did they cancel. All of this detail, again, can all be managed through the configuration that's set up within your EHR integration. And it's all built to be HIPAA compliant and secure so that you're not seeing anything above and beyond what you should be seeing from a HIPAA standpoint and from a security standpoint. If I need to actually dive into an Epic screen, I could do that as well. I can actually pull up the patient record right within Epic, again, as long as I'm logged in, and be able to actually see that data within Epic, again, without having to leave Genesys Cloud and go into a completely separate web browser or separate tab. All right. One last thing I will quickly get into is the customer journey. So one other thing that we do, especially when it comes to web chat or web messaging, is trying to determine or infer where was it on the website that they were at before they initiated the chatbot. And in this case, I've got what we call our Genesys predictive engagement turned on. And what that's doing is it's actually tracking all the different web pages that they've been to. We can even do segment mapping and put patients into a segment and infer what they're trying to do or who they are based off of their browsing history on our website. So I've got that full history of what pages they went to, and then at what point within that process did they open up the bot in order to start a conversation with us. And that might help us understand, do we need to make things a little bit more clear within the patient portal or on the patient website so that they're not having to go in and seek additional guidance or assistance from either a bot or from a live agent on our patient access team.
Trevor, I would like to add something here. Please stay on this.
Sure.
So since when I was discussing the patient journey that starts from patient going to book an appointment and go to the lab test and all that jazz, and PCP's visit to physician, to the specialist, to the in-home care, what is on the screen at this moment, that's the other side of the same journey. But this is more detailed at, let's say if I am booking an appointment, that's might be my first start on the very first black dot that you're looking at, that GTS, and then you carry on with this while the hypothetical journey that I showed you, if you map with this journey, that brings us a correlation matrix where we can, if we are the AMC administrator or clinical person, we will be able to look at the status of a patient's health, where he or she or they are at. And with this technical know-how that Trevor has graciously paused for me, that time would correlate towards the betterment of the patient, as well as average handling time of a certain discussion, a call or a chat, how you can optimize the next time when the same patient comes back. Back to you, Trevor. Thank you so much for giving me a chance.
Absolutely. And thank you. And that actually reminds me, Dr. Atif, with our predictive engagement tools within Genesys, what it can help us do is to help drive patients to take some sort of action based off of what they're doing in the website. So for example, if we know that we want to drive them to the patient portal, like a MyChart, and they're not going there, that's an opportunity for us to prompt the patient and say, is there something that that you want to chat about? Is this something where you might require some additional assistance with either a bot or a live agent? And we can actually proactively bring up the chat so that we can direct them more appropriately. It can be based off of what they're, again, if they're abandoning some sort of call to action, if they're spending maybe a larger amount of time on a particular page because maybe they're not understanding what they're reading. That could be ways that we can drive them to seek extra help and guidance through the chat.
Absolutely. The student patient journey that I shared with you, when that student patient is looking at the websites and jump into this arena, that's where the generative AI can automatically prompt it. What about this and this and this option? Would you like to choose one? And there's no human needed for that. And after the large language models, reincarnation, I must say, of the artificial intelligence. Yeah, you're right.
Perfect. Yep. All right. So what I'm going to do at this point, just kind of keeping an eye on the time here, is I'm going to go ahead and close out of this chat. I'm going to assume that hopefully uh, the patient access team associate had answered all the questions that the patient might have had. As soon as I end the messaging here, it is going to give a series of wrap-up codes on here, as well as the ability for me to put in any sort of notes about this particular interaction. Now I'm going to select one of these. I'm actually going to choose a Thrive reset here because I want to show you one other really cool partner integration that we have in just a moment with a company called Thrive. But before I do that, I'm going to go back to this little light bulb, this agent assist, because I'm again, as somebody who's really busy, and we're thinking about how can we best prioritize the time of your patient care team. I'm going to go back to Agent Assist, and instead of me getting this response, which we already used within the chat, it's now giving me an auto-generated summary of everything that transpired in this particular chat. So everything that happened within the bot, as well as with the agent, it gives me a nice little summary that's built upon generative AI. And I can then copy this and put that into the notes so that I'm not having to basically come up with a summary from scratch. It's hopefully improving the time efficiencies for me to go to the next call and being able to help the next patient that's calling in or chatting in or texting in, or even coming in through social media. I don't know if I mentioned this, but Genesys bots can actually be tied to direct messaging with Facebook, Instagram, X, and a number of other social media platforms. But regardless, rather than me spending 5 to 10 minutes after every single interaction and recapping what transpired in that particular transcript, let generative AI do the work for you, and then you can go in and just add color commentary, or you can change things, you can take things out, whatever you see is most appropriate, but at least gives you a starting point so that you're not having to start from scratch there. All right. Now I'm going to go back to the wrap-up codes. Again, I'm going to make sure that the Thrive reset is selected, because what's going to happen at this point, and these are all set up by your organization. You can have these say whatever they want to. It could be a billing question, could be a medication refill question. It could be something centered around appointments. You can see some of the sample ones on here. They don't necessarily have to line up exactly how I've got it set up in my environment. But I do want to do this real quick. And once I hit done, you're going to see a new interaction come into this window. It's going to be the next interaction, or in this case, it's going to be what we call a Thrive reset. Thrive is a Genesys partner. the reason why we typically talk about Thrive, especially to healthcare and academic medical and also universities, is because we see in these particular markets, there's a lot of agent burnout, right? You've got patients that are contacting you every day, and normally by the 7th or 8th patient interaction, it can be daunting, and you just need a moment to reset. These are actually called resets. And get yourself back in the appropriate mindset so that you're not coming away with this with compassion fatigue or anything along those lines. And what the Thrive Reset is, you can see it came into Genesys just like it's any other interaction, and it's set up, based off of whatever configurations that you have within your environment. It could be based off of sentiment. It could be based off of how many consecutive calls or chats you've had to take with patients before it comes with a reset video. And these reset videos are only 60 seconds long. A lot of them are focused on like breathing exercises or calming imagery, so that hopefully by the time you're done with this 60-second reset, you are ready to take the next patient interaction and you've had a moment to yourself to kind of get your mind clear. I'll just play the first few seconds of this just so that you can see what they look like, and then we'll move on.
This is a Thrive Reset. Breathe in and imagine traveling to the Sahara Desert.
So I'm going to go ahead and end it. I'm not sure if the sounds came through, but hopefully at least you saw the video that was displaying, where it told you when to breathe. It gave you some nice imagery on there. We've seen this with a few different healthcare institutions, and they've actually tested and run the numbers. And when they've piloted this, they've noticed that there's actually more productivity and better productivity with the groups that are using the Thrive resets than those that aren't. So we can talk more about that if there's any interest, but that's another App Foundry integration that that we're really proud of and have seen some great results with. All right, I think we have maybe 15 minutes left. Steve, I'm going to pass it back to you in case there's any questions that might have come in while we were presenting the demos.
We do. Thank you very much. Also, I had a question also right off the bat. In the very beginning, Doctor, we were talking a little about guardrails, small language models, large language models, and the importance of having eyes on some of the tools. I think what's very precious in the medical community, as well as some other, really anybody, how do you protect your data? How do you leverage these amazing tools and yet ensure that you're not putting your data and your enterprise at risk?
So that's a very timely question with the current status that is happening in the large language model closed source organizations that Apple has banned, ChatGPT, as well as Samsung. What we have done, we have taken the open source models and trained on our own data sets. And that's pretty much like, let me give you an analogy, that if you have humans, then human has names, addresses, and all that jazz. Then that becomes two different sets. One is a superclass, which is human, but associated to human is name, address, and all that. And that is technically a general knowledge. When we index all that using the large language model or the small language model, and let's say, for example, let's say take Trevor's information. Trevor calls in. Now we know it's a patient who's calling in who has a name, an address, and a certain, and then the indexes start matching on the back end. That's how the next potential word is generated. What would you like? How can I help? That's a generative question in terms of an answer when Trevor said hello. And when Trevor says, okay, I would like to see my doctor, there are two approaches. One is the rule-based, which is yay or nay, but there is generative AI that asks, would you like to speak with a physician or a specialist, because they have both services available here. That's not even a recommendation engine anymore. It's more human-centric, and large language model is technically do a plausibility calculation, not the probability calculation. So that's and how we store it under the HIPAA compliance or the PHI compliance. We actually work within the environments like AWS or Google. They provide us a HIPAA compliant storage. They provide us the FHIR implemented APIs where the data has been protected, being secured in a way that it even if it goes somebody MITM happens man in the middle attack, that will get the garbage, cannot retranslate it back. So that's and since my first PhD is in cybersecurity, so at GTS we have applied my own cloud security protocols as well. Hopefully this answers your question.
And just to add to that too, Steve, sorry, all the data that's going through Genesys is also audited, and we've got third-party attestation for HIPAA compliance. We do SOC 1 and 2, the EHR integration as well. We encrypt all of that data in transit and at rest. We've got TLS and HTTPS, all built within Genesys as well.
Right. I'd also like to add that we have since taken FIPS 140-2 encryption, and we've added it across all the regions, not just in the FedRAMP region. So while we are FedRAMP compliant for one region, we actually have taken FIPS 140-2 government standard encryption, and we've taken that across our entire footprint. So Genesys is very conscious of the data and how to protect it. Trevor, you mentioned, I heard you mention a couple of EHR systems, right? You mentioned chart. I know we talked about Epic for a few seconds. I mean, what are the other EHR systems that chatbot can integrate with, that Dr. T or Trevor, or that Genesys can, and how do we manage that securely, and how interoperable are we with other systems?
Yeah, that's a great question. So Genesys is an API first driven platform. So our entire platform is open. We integrate not only with Epic. I mentioned Cerner, Athena, but Genesys can virtually integrate with any system out there that has REST or SOAP-based APIs. So we've got standard out-of-the-box pre-built integrations with Salesforce, with Zendesk, with ServiceNow, with Sugar CRM, with Microsoft Dynamics. The list kind of goes on. And any system that you don't see in our App Foundry, where we already have a pre-built integration, Genesys has the ability to integrate with those systems. We would just have to build out those endpoints as part of the APIs. So our platform APIs are public. You can go to developer.genesys.cloud and see everything that we offer. But we've done several projects where customers have either a legacy CRM solution or EHR solution, or they need to integrate with one of the less common ones that are out there. And Genesys has been able to do that through our APIs.
And based on what Trevor just mentioned, we are working with Genesys like this as one organization. And since I have extensive background in the health institutions, we at GTS, we are maintaining a whole state university health system with the help of Genesys, and we are having our own encryption on top of it. But SOC 2 compliance and all that mentioned, being a CISO of the GTS, it's my first and foremost responsibility to make sure that our clients are secured in either or ways, and Genesys helps us a lot in that. All those APIs we have been working with, obviously we're working with AWS and Google in the same area, and that's where we are testing. The thing that you just have seen, the MedBot, has been actively tested in HIPAA compliant and FHIR applied and PHI compliant and PII compliant environment.
That's awesome. And when we talk about compliance, and particularly the chatbots and medbots, one of the most important features of being able to comply with any risk management framework is auditability, right? And logging. What kind of logging do you see, or the ability or capability with chatbots and the medbot to meet these audit compliance and to do some tracking, not only to make the data available for knowledge management, but actually for the compliance side of the house?
So it depends on the client we are working with. because we have to follow 100% compliance with the organizational compliance, whatever they are using, whether they are using auditing or logging. And we look at those areas by making sure that our audit process with our client, and then we bring in obviously the Genesys in to have a hybrid approach where it's a win-win situation for us as GTS, for example, the state university that I just mentioned, and then Genesys. So we make sure that all audit aligns before even we go and start deploying anything. So test deployment goes with Genesys hand in hand. And then in the end of the day, the client has to make a call which protocols they would like to go with. So that's the GTS standard, modulation that happens within the backend when we are serving any client.
And from a Genesys perspective, we keep the interaction history for as long as you want it. We've got retention policies that are configurable within Genesys. So if you wanted to, particularly with call recordings, if you want to purge after a certain number of weeks or months, that can be configured within the Genesys UI. There's also the ability to redact information that might be in the transcript. So if somebody gives you a social security number, for example, Genesys has the ability to recognize those types of patterns and redact it from the transcript so that doesn't live in your Genesys environment in the database itself. But all of that can get in terms of transcripts and interaction history, and see that Trevor Kelly as a patient called in on Tuesday, and then he chatted in, and then he sent an email in on Wednesday. That full interaction history is kept within Genesys, and that's really built so that it helps you map out those patient journeys as well, so you can see the full life cycle of everything that your patients have done within the organization, and see that whole interaction map.
So to
And
add on to Trevor,
yes, please.
Steve, the lineage maintenance at GTS is our priority. And that's where Genesys helps us a lot. But we have to make sure the lineage is maintained for the sake of all those 837Ps, 837Is. If you don't know what it is, go check out at Google. And if you're dealing with the pharmacological, you have to deal with the 272s and package coding. But that all need to be redacted, and that we take care of that at our end as well. And since we have now that large language model enabled, so if an administrator is looking at a record of Trevor Kelly, then all the main social security and all that automatically redacted or removed by the generative AI algorithms guardrail. So it's only given a yes, Trevor Kelly called at this time, was inquiring about the health condition and the lab tests, and that goes on. And that is a generated answer rather than a rule-based answer that comes in. Back to you, Steve.
Well, so one of the things we've danced around a little bit is the general configurability, whether it's retention policies, whether it's sanitizing the data and the data end. But let's talk about the chatbots themselves. I mean, one of the questions I have here is how customizable is the chatbot? How can it be tailored? How does it integrate with existing systems? Is it not just out of the box, right? I mean, this is something that we can pretty valuable, right? We have the ability
Yes.
to.
We can tailor this chatbot that I just showed you for housing and urban development, Department of Homeland Security. Because in any case, if let's say Kate even calls to harbor housing and urban development, that we must know who Kate is, where she's calling from, what are the questions that she has posed in terms of apartment renting or in terms of going to buy some foreclosed house. So that is the information that is extremely important for housing and urban development. Whereas the TSA, for example, if we tailor the chatbot to TSA's perspective, if Kate is importing something, then TSA must make sure to qualify that Kate is qualified to bring in these goods in the country, and these goods are within the ITAR and EAR, and she cannot export it, or she is restricted to export, and all that information. So we can tailor this even in an admission of a university for a registrar's office to answer. but by making sure that it is FERPA, FERPA, FERPA compliant, and a parent who's not been given an attorney the authority to look into the child's thing should not be able to look at that. Or a third party, a professor or a friend should not look at that's FERPA compliance. So this chatbot, the GTS MedBot, is technically an omnibot, which is tailorable according to the environment where we are working with. And obviously, Genesys provides us such a nice connectivity that I just showed you that our chatbot and then transfer to Genesys bot, and all the relationship or lineage was given there before.
And just to add to that too, I think Dr. Atif, we might have you and I talked, I think a few weeks back, and we were kind of looking at all the different use cases that an AMC or a healthcare institution might want in terms of an intent model for the bot. So it's like, you know, you talked about a few of them. I want to make an appointment. I want to make a payment. I want to get a prescription refilled. So collectively, we've actually put our heads together and we've looked at all the healthcare and AMC use cases that we've kind of looked at over the course of the last several years. And we want to make it easy and turnkey for new customers to be able to reap the benefits of what we've already built for other customers. At the same time, we know that every institution has their own unique needs. And so it's flexible enough so that if we need to build something out on top of what we already offer as part of some of those packaged use cases, we've got the ability to do that. It's a very configurable system. It's very easy to add in additional use cases above and beyond some of the standard. I want to make an appointment. I want to remind you of an appointment. I want to refill my prescription. It is a flexible environment that allows you to expand beyond just what we offer, kind of some of those pre-built.
So we were, yes, Trevor, absolutely correct. We were discussing about a route optimization where truck goes on, and you don't need you type it because it's voice enabled. It speaks back with you in generative AI. You can send a note, and the generative AI can send that bridge is closed, take the alternate route, and that is voice output. And trucker can say how much time it'll take extra. You might be going 6 minutes extra, but that should be fine. That's a country route. You can take that.
Excellent.
That's another, yeah.
You know, they're kind of right up against the end of the timeline here. I think we had this conversation going for quite some time, but I believe there's also another episode in the series coming up. So everybody's going to want to tune in and see where we go next. I want to thank Dr. Time, Trevor, again, as usual, fantastic. And of course, Caresoft, again, for sponsoring this. This is great. I think the little housekeeping at the end, I believe this will be made available and accessible to you if you missed some of it or want to share it with your friends. Please, and if you have any questions, please, feel free to reach out to Dr. Trevor or myself. You'll have some other contact information that's included. And we welcome any other further questions and follow on, and please do not hesitate to call.
Thank you so much.
There we go. There's contact information.
All right, thank you so much to our panelists, Steve, Trevor, and Atif. It was a great discussion today. And like Steve said, stay tuned for the third part of this series, which a new date is pending. So we'll reach out to everyone and let you know when that's scheduled. Thank you everyone again for joining us today. We hope this information was helpful to you and your organization. Please reach out to any of the people here. Their contact information displayed on the screen. And a follow-up recording will be sent to all our attendees. And thank you and have a great day.